It's connected now. All right. Well, good afternoon or good morning, wherever you are watching this, and whenever you are watching this recording. My name is Dr. Callie Wample Edwards, and I am the owner of The Life of a Scholar, which we are a consulting organization, and we focus on really helping you realize and reach your full potential. And I am so thrilled to have our first scholar chat with none other than the Dr. Williams. Clap it up for our studio audience. I will give her the floor to please introduce herself, but we are just so thrilled that she had the opportunity and you accepted our invitation to come and tell your story this afternoon. So thank you so much.
Oh, you're so welcome. I'm just so happy to be here and looking forward to our discussion today. And should I just go right into my introduction?
Yeah. So, my first question for you is just, can you tell us a little bit about yourself? Who is Dr. Williams?
Oh, so Tomika Williams is my name, and most of my friends call me Mika. That's kind of my nickname. But who I originally am from Greensboro, grew up in Greensboro, North Carolina. Went to Grimsley High School here, and then kind of moved into my university stuff. And I know we'll talk about that a little bit later, but outside of what I do academically, I am a cat lover.
Yes.
They say, who am I? I love cats. I am a crafter, a paper crafter. I love paper crafts. And I also like vocal like music. So people just sing. I actually sing in some choirs at church. And I'm a traveler and a reader. Love books. Actually love tangible books. I have been resistant to buying a Kindle.
Oh, so actually like having the
I like
tactile,
having the
like
book.
flipping
Yes,
the
flipping
pages.
the pages.
Got it. That's awesome.
Yes.
Well, can you tell us a little bit about your scholar journey? The Scholar Chat is really kind of to be a little inside look at what it takes to become who you end up becoming, right? So can you tell us a little bit about your journey to become Dr. Williams?
Absolutely. So I think I will start with kind of where I matriculated. So I graduated from Grimsley High School and went to North Carolina A&T, whoop, whoop, Aggie Pride, for undergraduate, my undergraduate education. And there I, of course, majored in nursing. And when I left A&T, I got accepted into a nurse extern program. Okay. And that was at Alamance Regional Medical Center in Burlington. And I worked in that, worked for that hospital system for that whole extern year, or intern year is what they call it. And I did some work on cardiology units and on a oncology unit, kind of with cancer patients. And then one other unit, which I cannot remember now, but I ended up going back to cardiology, and that was my love. So I probably would have stayed in cardiology throughout my career had I not made some other changes, because I just absolutely love the function of the heart in the body and kind of how it works and what it does. So I stayed there for like a year and a half, and then I transitioned back to Cone Health System here in Greensboro, which is where I live. And I always knew I was going to go back to school, because I said, I either want to teach or do something else with patients. So I ended up going to UNC Greensboro to obtain my master's degree in nursing as a nurse practitioner. When I left UNCG that time, I ended up taking a job at Wake Forest University Health Sciences in Winston-Salem. And I worked with patients who were rehabbing from their long hospitalizations. So if you had stayed in the hospital for any length of time and was ready to leave that particular unit, but not quite ready to go home, you would come to the rehab unit. And we also got patients who, of course, had traditional, like their hip replaced or their knee replaced. So it was the rehab unit. And there was my first job as a nurse practitioner. And I really learned a lot working on that unit, especially about interdisciplinary care, meaning working with other health professionals. Because if you know anything about rehabilitation medicine, it is the team effort. So it's neurology, neuropsychology, social work, occupational therapy, physical therapy, nursing, speech therapy, recreation therapy, you name it. Okay, we're all working together to take care of these patients. So it's very good experience for what I'm doing now. So I worked there, and then I got an opportunity to work for a private physician in Asheboro, North Carolina, and totally different role, but he was looking for nurse practitioners to work in the community, which ended up being what I love and what I continue to do now. And so I took this job, transitioned from there, took this job, and worked with him, honing my skills in long-term care, so nursing homes. And oh, people, when I say that, are like, oh my gosh, but yes, nursing homes. And I worked for him for 11 years. Yes, 11 years. And then got the bug that maybe I wanted to do something in higher education and teach, because I had been precepting new nurse practitioners, people becoming nurse practitioners, working with them. I thought maybe I want to do something with that. Let me try my hand at that. And so I ended up going back to school. And this is where I go back to school to get my PhD, and I meet the divas and everybody else. And so I ended up going back to UNC Greensboro to complete my doctoral education in nursing, and finished that in 2016. And so I would say my road to becoming Dr. Williams actually started with like my love for the career I chose, the career path I chose, nursing at the beginning. When I was that new nurse graduating from A&T, I never thought I would be here, Dr. Williams. But that's been the road.
Wow, that was so awesome. And I love what you said about, you really fell in love with your career.
Right.
And then from there, you kept developing more
Right.
skills, and you were saying, like, I was at this position and I honed this skill set, and then I went to this position and learned a different aspect. And it was almost like it kept building on each other.
Yes.
Yes. And for folks who aren't familiar with the Divas, that's an excellent organization that both Dr. Tomika Williams and I are part of. It's a support group for it's for all women really who are pursuing their PhD or in their early career, but specifically for Black women. So it was a great sisterhood and support for both of us as we were going through our processes. Yes.
And I'll say too, in my journey, I found school to be a safe place for me. School has always been a safe place for me, which is why I kept going back. I feel very comfortable in academic environments. Not that they don't challenge me, but I like to learn. And so that's why I kept, if it wasn't a degree I was working on, maybe it was a certification or something like that. So yeah.
And see, that's I'm so glad you brought that up, because one thing that we talk about a lot here at the Life of a Scholar is, what does it really mean to be a scholar? And one thing that I always thought of growing up is that, a scholar has to look like this, or do this certain thing, or have this certain GPA. Like, I had all these preconceived notions based on like societal standards of what a scholar was. And so that's one reason why Life of a Scholar even came to be, is I was trying to challenge that notion.
Exactly.
Did you always see yourself as a scholar?
No. And actually just recently, I would say maybe in the last 2 or 3 years, have I really embraced the term for myself, because I have always thought of myself of late as more of a clinical expert. Like, this is what I do. I know how to take care of patients in this particular patient environment. I've done it long enough that I feel like I have a certain level of expertise. But like you, I had preconceived notions about the term scholar.
Mhm.
And so even in my discipline, it led me to investigate what other people say about scholars in the field of nursing, what that
Mhm.
means. And
Mhm.
so, of course, I mean, across all disciplines, we all are familiar with Boyer's term of
Yeah.
scholar and
Yeah.
scholarship. But, there's other definitions of what a scholar
Mhm.
is. And so I definitely appreciate this platform and your company for looking at that and challenging that notion. And so for myself, I think, like I said, just in the last year or two, I've embraced it. And again, I think probably I didn't embrace it was because I thought, okay, it had to be this, and I wasn't that
Mhm.
yet. So
Exactly,
yeah.
exactly. Awesome, awesome. Well, Dr. Williams, you are so accomplished. You have your, as you stated, you have your PhD. You also have your undergraduate and your Master of Science in nursing. You have years of experience in different capacities in healthcare. So in terms of long-term care, as you shared, inpatient rehabilitation, and also occupational health and wellness. When you look over your career or your experiences in general, what would you say is your or one of your greatest achievements?
So I was thinking about this, and I didn't know if this meant like academically or just in general. So in general, I would say one of my greatest achievements is really settling into becoming the nurse that I am and not
Mhm,
trying to be the nurse that others defined me as. I think
mhm.
when you first get into the profession, you're trying to get additional letters behind your name, if you will,
Yeah.
to validate that you're supposed to be here. I
Mhm,
think one of my greatest achievements then is I've gotten assured of myself in that this is what I was not only chose to do, but called to do. And so I'm
mhm.
very comfortable in that. And so, and able to articulate it because a lot of people
Yeah.
can't say that,
Yes. Yes.
they can't say it. The other piece when I was thinking about this academically, I think one of my greatest achievements is completing that PhD.
Yes.
It
Yes. In that, what is it, 2%, they say?
exactly 2%. And,
Yes.
as you and I both know, for minority women, particularly Black women, we are um, not many of us
Yeah.
who attain
Mhm.
PhD education across disciplines. And also in my discipline in nursing,
Mhm.
not many
Mhm.
of us. And so it is one of the highlights of my career,
Most
period,
definitely.
is that completing it, finished it, just excited about it.
Yes, yes, and
Yes,
I'm sure I'm so excited for you too, and I'm sure that the students listening to this can be inspired if they see themselves as I may want to get a PhD in nursing, but I don't see someone who looks like me or who's done
right,
it before me. They can look to you for inspiration, like you did it. So
absolutely. Well, a lot of people don't even think you can get a PhD in nursing because
oh, tell us more about that.
I've even gotten that question like, so you have a PhD in what? And I'm like, in nursing. Oh, okay. So what does that mean? Because nurse, doctor, in the same sentence
Mhm.
doesn't kind of go together, But yeah, I think traditionally, I mean, the profession has been known for our advanced practice roles, of course. You know, nurse practitioners, clinical nurse specialists, midwives, certified nurse anesthetists. Those are all master's level prepared. And we have some other ones too, certified nurse leaders, a whole bunch of other ones. I'm just naming a few. But um, when you think about terminal education, um, I think people were aware that you could get maybe like an EDD if you were going to teach. Um, but it's just uncommon, I think, that people knew about that you could actually get the PhD in nursing. And now, particularly in our field, we have a clinical doctorate track, which is the DNP, the Doctorate of Nursing Practice. And so we have a lot of clinicians who choose to do the clinical doctorate versus the research doctorate, which is the PhD. Mm-hmm. Yeah.
Excellent, excellent. So many options out there. What I think I'm hearing you say is, don't sell yourself short. There's lots of pathways, and really kind of being aware of what the options are.
Awesome. Exactly. And then another thing, I attended a leadership academy several years ago in nursing, and one of our session was focused on deciding when enough is enough. Because I'm sure this is not specific to nursing, but in a lot of disciplines, there's a push to get more certifications, to get more degrees, to get more training, to get more. And a lot of times professionals feel like it's just never enough. Like, I got this and now I got to go get something else. And now I got to go get something else. And now I got to go get something else. And so this particular person who was doing our training several years ago challenged us to think about, really take some time to reflect and decide, when is enough for you? So if you decide that I'm going to go to school and obtain my bachelor's in nursing to become a registered nurse, a licensed registered nurse, and that's enough for you and you're satisfied and fulfilled in your career, then that is absolutely fine. And there should be no pressure.
I love that, figuring out what works for you. I think that definitely applies to so many career fields. Yeah, because I think it's easy for students to kind of see it as, well, if I don't get this additional certification or degree or whatever that next thing is, and I'm not accomplished. And that's not the message that we're trying to push here. If you want more education for, the enrichment, or if it's going to help you in your field, by all means, but figuring out what works for you and your life and the impact you want to make, because not everyone needs certain certifications or certain additional education to pursue their goals.
I have a dear colleague who did just that. Went to school, obtained her registered nurse degree, bachelor's degree, never went back and got any additional training. In fact, ended up starting a business
cool.
On the side. So worked as a registered nurse, started a business, and basically her whole entire career, she ended up, not leaving nursing, but doing her business more, primarily more, and has been so fulfilled in her nursing career. And so, the individual students, everyone just has to decide kind of what your career goal is, and let it be your goal and not the push of what everybody else is doing around you.
Yes.
Be okay with that.
That's a scholar tip for anyone listening. That is a good scholar tip to apply to your journey. Figure out what it is you want to do and be okay with that. Don't necessarily think about what society says or what your friends may think, or whatever the case may be. Do what is in your path.
Exactly.
For you. Excellent. Sorry, go ahead.
No, that was it.
I was gonna say, this segues really nicely to our next question around what has been your greatest lesson or learning experience. I know I just gained a lesson hearing you talk about, figuring out what it is that you want for your career and pursuing that.
So one of the greatest lessons I've learned is it's okay to ask for help. I think all of us, students, professionals alike, we tend to have a little bit of that type A driven personality. Like, I'm going to accomplish this. I set this in my mind and I'm going to do this. And we push ourselves and we're resilient and we push through. And sometimes, though, we need assistance along the way. And it is okay. It's not a hit to your intelligence by any means, but help is needed and appreciated. There's an old saying, with child rearing, that it takes a village to raise a child. I think to be a well-rounded professional, whatever discipline, then since I'm talking about nursing, I think it takes a village. Like, I didn't just wake up and get here. Like, there were so many people that assisted me and helped me and continue to help me to be here, to be this version of me that you see. And so definitely learning that it's okay to say I need help is a great lesson. And then the other point that I just made, that it is okay to choose your lane and stay in your lane, whatever that lane is. So it's okay to do something non-traditional or out of the box that nobody's like, what are you doing? Yeah, this is what I'm doing. And that's okay. That is okay.
Excellent. That is great advice. That is such an awesome perspective to have. And thinking more specifically about the scholars listening who, may say, I do want to be a nurse. I'm interested in nursing. Do you have any advice for them as they kind of pursue that career path?
Absolutely. So the first thing is, do not give up. Number one. And I say that wholeheartedly because nursing schools are so competitive to get into. And so you might apply for 4 or 5 schools, and maybe you might get some no's, but keep going. Somebody will let you in, okay? Do not give up your dream because you hit a wall. So that's number one. If it is in you, I mean, the core of you wants to be a registered nurse, you keep going until you get in. You will be a registered nurse, okay? So that's number one. Number two, I would say that nursing is so broad. There are so many things you can do with nursing. So we traditionally think of hospital bedside. That's kind of the traditional role that people think of. But we have nurses doing everything from advocacy at the legislature to nurses who work for insurance companies. Yes, like big companies like United Health Group hires tons of nurses, tons of them.
I would tip in case you didn't know.
Yes, nurses who work in schools. So they're nurses, school health nurses. Of course, nurses who work in public health departments and community centers like long-term care centers or dialysis centers. We have nurses that work for, like one of the things in my expertise is working with occupational health, and that is for businesses, these big businesses that hire nurses to work in their on-site clinics, so that if you're at work and you notice that you have the sniffles, instead of taking a day off to go to the doctor, you go down to the worksite clinic, be seen by the nurse practitioner, and then you don't have to take a day off. The company keeps you at work and you're also treated. It's a great win-win for everybody. So nurses there, absolutely. They're nurses. The roles for nurses are vast. I mean, I could just go on and on and on about the things you can do in nursing. So don't just think that it's one thing you have to do. But the other piece of advice would be nursing is a science and an art, and the basis of all nurses is just a care for humanity. Like, you have to care about people to be a good nurse. You do. And whether you become a nurse informaticist, which is really popular right now, nurses who deal with electronic medical record systems and big data systems. And so they're not the nurses that are on the bed at the bedside taking care of patients, but they're still using their nursing skill set to work with these health systems that we need to talk to each other, to translate data to each other. And so whether you do that or whether you're a professor like myself and you're teaching other nurses, it's so broad, but all of us, at the core of us, we still have to have that care for humanity, care for people.
Yeah. That's like a central value, it sounds
yes.
like, regardless, no matter what,
regardless where you go,
whatever hat you put on,
right.
at the core.
At the core. So those would be my pieces of advice.
Well, that is great advice, and I hope students, you're taking notes, that these are things that they put into practice today if you are interested in pursuing this career field.
Absolutely.
nurse. And that's so exciting too, to learn about all the different types of roles and different positions and organizations that you can work for with a background in nursing, not just a one size fits all kind of situation.
Right. Absolutely.
Is there anything that you would like to share that I haven't asked you? I do have a couple of additional questions, but I wanted to pause here, see if there's anything that you wanted to go deeper into, or share more about your background or any advice.
Well, I'll just say just a brief little bit about my current role as a nurse practitioner. And maybe some of the scholars don't know what that is. So a nurse practitioner is a advanced practice registered nurse, meaning I went back to school, obtained master's level education, and took a certifying exam to get approved to be able to do some medical acts. And by that, most nurse practitioners, regardless of the specialty, we are able to prescribe like a physician would be able to. We are able to diagnose like a physician would be able to. We have some approvals to do some medical acts. We did not go to medical school, so hear me clearly. We are not physicians.
Yes.
However, we have advanced training beyond our registered nurse training that allows us to manage patients. So you could inevitably come into a practice and not see a physician, but see a nurse practitioner. And that nurse practitioner could diagnose you, examine you, diagnose you, prescribe what you need, and you go out the door. And so my role, I've been a nurse practitioner 17 years now. and so I primarily work in long-term care, but I've done a few other things. Like I said, I worked in the rehab center, and I work in occupational health some as well. But I absolutely love taking care of patients in nursing homes, which is something you rarely hear people say. I actually love the nursing home environment. I feel like it's an untouched environment, not untouched, but just not touched a lot. And so I love taking care of old people. And so my certifications are actually geriatric certifications. And so that's my specialty. I've got a lot of training in taking care of older people and conditions that you commonly see in older adults. But I love that. And I get to do that now. I used to do that full-time before I became a full-time professor, but now I do it one day a week to keep my skills active.
Yeah. Excellent. Well, thank you for breaking that down for us, because I know I've heard the term nurse practitioner, but I didn't know all that went into becoming a nurse practitioner. And so I really appreciate that perspective. And I know the scholars will too, because that's even another pathway.
It is
in nursing, that if you want advanced into a skill set and get additional training.
Absolutely.
And you did share your certifications are in geriatric
yes.
Can you share for scholars who may not know what that means?
Sure, absolutely. So geriatrics or gerontology, depending on what you're reading, is the care of older adults, primarily patients that are, or clients, patients, clients, residents. We use those terms depending on where they are, who they are, but 65 and older is usually the age, and that age is set by some bigger organizations and bodies. I know people get the little card in the mail from AARP when they turn like 55 or so. But AARP is an advocacy organization, but they, you're not quite to the age yet, but so 65 and above. But my current certification as a nurse practitioner is adult geriatric. So it's a dual certification. And the adult piece of my certification allows me to see patients 13 and older.
Oh, wow.
So I can see someone as young as 13 all the way to the end of life.
Wow.
And if you see the more common nurse practitioner role is the family nurse practitioner, or FNP. You see that a lot. A family nurse practitioner is approved to see patients from birth to the end of life.
Oh,
So
wow.
the difference would be that I cannot see anybody less than 13.
Gotcha. Okay.
And there's a whole nother list of different nurse practitioner certifications. For example, psychiatric mental health and neonatal and pediatric and women's health and acute care. I mean, I can go on the list of nurse certifications, but the specific certifications just highlight our area of expertise.
Gotcha. So where the age range or
age range,
type of patient that
right.
you probably be
right.
Gotcha.
Yeah.
That's really helpful.
Yes, absolutely.
So I have a couple of additional questions, just
Sure.
thinking about the scholars who might be listening to this recording. Some of them are in college now. They might be pursuing their bachelor's degree or even their associate's degree. What is the top thing that you wish that you had known either before college or before graduate school? What's some kind of insider information that we can leave with the scholars?
So definitely before graduate school, I wish I would have known more about taking out loans.
Yes.
And the impact of those decisions post-graduation.
Yeah. So, we talk about that a lot here at the Life of a Scholar.
I wish I would have known more about the impact of those decisions as I was signing my name on these lines for these loans. Yeah, I wish I would have known that. Definitely.
So probably a tip for the scholars is to be mindful of like financial aid opportunities, yes. any free financial opportunities, yes. Like scholarships, grants, work study, yes. Those things you don't have to pay back. And then if you do have to take out some loans, let's be smart about, what's strategic rather on like how much you're taking out, what the percentages are, just kind of be more mindful.
Right. Because I made some
world out there. I mean, we don't get this. This is why we have these conversations. Because if you don't know, then how would you know? So yeah.
Well, and like I said, I wish I would have had more information, even in my undergraduate education, because I mean, I did get some grants my first 2.5 years, but then going into that last year, a loan was offered, and I'm like, yes, let's take the max. And I didn't really need the max.
Yep.
And I think sometimes we, my 20-some-year-old mind at that time was like, this is free money. And it really was not free money. And so definitely that. And another thing that I wish I would have known is, and this was for undergrad and grad, is how important it is to connect with your faculty beyond necessarily the classroom. And this, and what I'm trying to say is there's so much that they can pour into you that they don't necessarily do in the classroom setting.
Yes.
Like you get it in these conversations, or let me stop by the office and there's this nugget they give you that's so like it changed your life or something. And I feel like I spent a lot of time because in undergrad I did not stay on campus, so I spent a lot of time away from campus. I think if I'd have spent more time and not necessarily every day, that's not what I'm saying, I'm just saying glean from them what you can while you're there.
Yes.
They are a wealth of knowledge, and it became even more vital to me when I was getting my doctorate.
Yes, and I can concur with
that.
You're right. Sometimes the conversation that you have in passing. Not even in the meeting. Like if you're going to their office, it's not really in the meeting. It might just be in the hallway. You're like, oh, I didn't think of that. Let me look
read
up on that, or opportunity. So kind of being in the right place at the right time.
At the right time. Absolutely.
That is such helpful advice. When you think about the skills or experiences that someone may need as they are entering nursing, some things you already shared with us are having kind of this compassionate heart for people, and also kind of what I'm kind of gleaning from you is kind of realizing there's so many different ways to get involved with nursing and really trying to figure out your passion, like what population you want to work with, or what part of the body you talked about earlier about cardiology and really loving working with the heart. So like kind of figuring out those nuggets. But are there any other like skills or experiences you think might be valuable for someone as they are entering nursing?
Absolutely. I think one of the most valuable experiences to have, if you can possibly work this out, is to become a certified nursing assistant.
Yes.
So I worked as a CNA for 2.5 years while I was going to school. And let me tell you, and any nurse will tell you this, the CNA is vital to you doing your work. The CNA, he or she, knows the patients almost better than you because they spend a lot of time with them.
Yep.
They are your first set of eyes when something is not quite right. And it is a partnership like none other when you're taking care of patients. When I came back to the Cone Health system, I worked as a CNA on a rehab unit, which is really weird, on a rehab unit while I was in nursing school at A&T. Then I went to Alamance Regional, got that job. When I came back to Cone, I worked on a cardiac unit, like I said, my love. And let me tell you, the aides, I worked third shift at that time. I couldn't have done my job without them.
Yeah.
And my experience as an aide on the rehab unit was vital to me, knowing not only what I was going to be doing as a nurse, but also their role, so that when you get out and you're working, you understand that this is a team effort. It definitely will hone some of your assessment skills. If you have that experience, it will help you develop those and sharpen those. It will help you to learn how to establish rapport or a good relationship with the patient. But because before you can work with the patient, clean up a patient, give a patient anything, you've got to establish a relationship. They've got to trust you to a degree, and it's the same thing when someone's coming to your home. You're not going to let anybody in your home without them knocking, right?
Just walk right in.
Right, just walk right in. What? No. Okay, so it's the same thing. People want to feel that you're personable and that you care before they allow you to start doing stuff to them.
Yes.
So absolutely, if you can possibly, the experience of being a CNA will only help you. Now and this could be a whole nother talk, there's so many different roles outside of becoming a registered nurse that also could help. There's the personal care assistant role, or PCA. A lot of PCAs also have their CNA certificate, but not all of them do. So a personal care assistant could be hired to come in someone's home and help them with light housework, light meal preparation. It still is a way to interact with people, get involved with caring for people. And then there is the certified medical assistant, or CMA, which is a lot of CMAs have been CNAs before, but that's an associate degree preparation role. A lot of CMAs work in doctors' offices and community organizations, and they have some advanced training beyond the traditional CNA role.
Gotcha.
So there are many ways to get some healthcare skills, but I definitely think being a CNA was most valuable. And in my opinion, this is my own opinion, I think you're a better nurse if you've had an experience as a CNA.
Gotcha.
You've got to know how to clean up people and make beds, and you just have to.
Those essential skills.
It is, yes.
People, as you're saying, learning that rapport, the
Right.
relationship building, all of that. Excellent.
Yes.
Excellent, excellent. Well, this time has gone by so fast. I feel like we had just started talking.
Oh my gosh.
And I was like, oh my goodness. We have been talking for over 30, probably 40 minutes now.
Oh, wow.
I
Okay.
don't want to make this too long, but I definitely want to first thank you so much for
Oh,
sharing
you're
all
welcome.
the expertise with us on this first Scholar Chat. But before we go,
Yes.
definitely wanted to give you a chance to talk more about how people can reach you.
Yes.
You do have a business, so if
Yes.
you want to talk about how they can connect with your business and any kind of information that you'd like to leave with the audience.
Absolutely. So again, thank you for the invite. Thank the scholars, everyone who's going to listen to this. I definitely appreciate it. Anybody who's interested in nursing and wants to reach out to me, please do. Absolutely love the profession to the utmost. So I do have a business venture. My business name is Golden Health Education and Consulting. It is a education and consulting business. And I primarily, I get invited to speak on different health topics and such. But the central goal to my business is to work with administrative leadership in long-term care facilities to assist them with things like staff retention, decreasing their survey fines, helping them to increase their revenue or save their revenue by decreasing staff turnover. I'm really interested in staff development in long-term care facilities, but I don't just do long-term care. As I mentioned earlier, my certification is adult gerontology, so I can talk about a myriad of things. So just, and so my website is www.tomikawilliams.com. And on Facebook, it is Golden Health Education and Consulting. On Instagram, it is Golden Health Education because it ran out of words. On LinkedIn, I am Tomika Williams. And on Twitter, I am Tomika Williams, but it's at Tomika Empowered on Twitter. But
and so we will include all of those links underneath this video or beside the video, whatever social media platform we're on, so you can click those quickly to connect with Dr. Williams.
Absolutely. Would love to connect with anyone.
Well, thank you so much. Again, this is our first Scholar Chat, which is meant to be a virtual conversation with scholars. So thank you for being our first guest.
I am the first. I'm so happy to be the first.
This was so fabulous. So thank you.
You're
and
welcome.
If you would like to connect with Dr. Williams, like we said, we will leave all of her information with this video so that you can reach out to her directly. So thank you so much. And we will stop the recording now.
Okay.
Thank you for participating, and thank you all for listening to Scholar Chat. Again, my name is Dr. Callie Wumble-Edwards, founder of The Life of a Scholar. And if you'd like to connect with us to learn more about Scholar Chat or any other events that we host, such as Scholar Academy and a myriad of other opportunities, outreach opportunities, feel free to connect with us at thelifeofascholar.org or on Instagram at The Life of a Scholar, or on Facebook at The Life of a Scholar. Thanks so much. So let me do that.